I'm Chelsea Swanson with the Cindy and Todd Johnson Center for Pediatric Feeding Disorders at St. Mary's Hospital for Children in Queens, New York. Today, I'd like to talk about the role of behavior in pediatric feeding disorders and how we address it using applied behavior analysis, or ABA. ABA has been used to treat pediatric feeding disorders for about 30 years. Several factors can contribute to feeding disorders. These can be medical, oral motor, developmental, or some combination. In most cases, however, effective treatment requires addressing behavior too. When we say behavior, we mean simply anything that someone does. In ABA treatment, there are no good behaviors or bad behaviors. There are only behaviors that support healthy eating and behaviors that interfere with it. Using ABA, we identify, teach, and reinforce behaviors that lead to healthy eating, like sitting in a chair, taking your bites, and trying new foods. At the same time, we do not reinforce behaviors that limit learning, such as refusing or crying. All learning occurs when a behavior produces reinforcement. Some of us learned to eat chocolate because the taste of it is, for most people, a positive reinforcement. This made it more likely that we would engage in behaviors like buying candy so that we could enjoy chocolate again. Our program uses positive reinforcement to teach kids how to eat and enjoy meals with family. Here, every bite or sip receives enthusiastic praise, a smile, a high five, or a time with a preferred toy or activity. We know that parents do their best to encourage their child to eat, but often fail. This then leads to allowing them to eat whatever, whenever, or wherever he or she chooses. When this happens, children and families often accidentally fall into routines that have a negative impact on the nutrition, development, and health of that child. We know that the behavioral challenges in feeding disorders are often beginning accidentally. Here at St. Mary's, we teach children new ways to eat. Most important, though, we also teach parents and the caregivers the behavior management skills they need to support that progress. Applied behavior analysis guidelines helps us in creating uniquely individualized treatments. Thank you for your interest in St. Mary's, where big hearts help little patients.